All right, great. I think we're live. Thank you everyone for joining us. My name is Sarah Kabe. I'm the teaching assistant for the online course, Early Childhood Development for Sustainable Development. I'm really excited to have you here with us today. Thank you so much for writing in and introducing yourselves. We have people from Nepal, Turkey, Ghana, Burundi, India, Kenya, Boston, and then we are here in New York City. And so I'm really excited to introduce Dr. Hirokazu Yoshikawa, who is the lead professor for our course. So I'll just let him say hello.
Hi, everyone. I wanted to thank you all for joining our course. This is the second offering, but we've been really delighted with the level of engagement on the discussion forums, and we're looking forward to your questions today. And this will be the first in a set of these webinars, and we will have a webinar from each of our primary faculty, including Jack Shonkoff and Catherine Tamas-Lamanda and Aisha Yousafzai. So you can watch out for when those will be scheduled. I believe the next one is next week with Professor Tamas-Lamanda, and Sarah will give details about that again at the end of this and on the courses web platform. But again, thanks for your participating in the course, and we will be posting a recording of this webinar on the course website so that anyone who couldn't watch today or who couldn't be online at this moment will be able to log on later and watch the our session today, which will be an hour.
Great. So thank you everyone for writing into the chat window. It's really exciting to see where everybody's writing in from. So please feel free to continue to use that window to ask your questions. So I'll be managing the chat discussion. So write in your questions into the live chat, which is on the right-hand side of your screen. And if you have a follow-up question or would like to add on to what someone else has said, just please feel free to write in there, and I'll be fielding questions both from this live chat and from those that people have submitted both over email and through our online discussion forum as part of the course platform. So I'd just like to start with a question from Hasina Ibrahim, who wrote in to ask about the team's perspective about how this course might change the field of ECD after its completion, or how do we see you, our participants, moving forward with this information, and just what is the general goal of the course in terms of relating to the field of early childhood development. So Hiro, do you want to respond to this? I think it's nice to start off with a really broad, high-level question.
Sure, yeah. So I think there's a few ways that we've thought about this course potentially changing what one does, right? And I think that depends a little bit where you are in the field. We've been, very delighted to see the diversity of students who take this course, both those who are maybe from academic settings, but I think we may have even more who are from positions and working actively in the field around children's development. So these might be staff in NGOs, it may be folks working in government, maybe folks working in civil society organizations in various countries. And so this course is meant to provide an overview not only of, I think, the basic science of early childhood development, which is really the first 3 weeks or so of the course, but as you'll see, the rest of the course really focuses on program and policy implementation. And that is designed both, I think, for people who are not working in the field to understand examples of programs in sectors like health or nutrition or education or social protection and child protection. Community-based programs, programs that are responsive to particular situations like conflict or migration, but also to provide a sense of the scope of the world's programs and policies that are responsive in early childhood development. And that is for people who are working in NGO environments and doing this as part of their work. The early childhood development field often isn't one that comes with particular technical preparation, if, for example, you're in an NGO setting and you're moving from one sector to another, or let's say you are a general social protection specialist, and then you're taking on a program in ECD. So this course is intended to provide that and to help inform the actual work. And what we've heard from the prior offering of the course is that it did provide some helpful input and ideas for programming, for issues like quality and equity to people already working in the field. Then I am going to say that in the last week of the course, we do have some explicit focus on how to bring this forward. And we'll see that that's what Pia Brito from UNICEF is going to talk about in the final sessions. And so we're going to return to this topic of what can we do to bring forward the contents of this course, bring it into your work and plans for after the course. So thank you for that.
All right, great. So we have a question from the chat. So this is coming from Shivam Kapoor, writing in from India. And he said that in Module 1, it was stated that the newborn child is capable of learning any language that he is exposed to in his environment. And so so Shivam here is asking, how does that affect brain development? And will a child be only able to learn one language at a time, or what happens when a child's brain is exposed to multiple languages?
That's a great question, and there is research on that topic. And so just to be clear, humans can learn multiple languages at any point in their lifetime, but there's been more questions and research about it in the earliest years because of precisely your question, which is when infants and toddlers are exposed to multiple languages, how do they tell them apart, right? And how do they not get them confused? It turns out that infants, toddlers, and young children can indeed distinguish different languages. They can understand, as we've seen that social and cognitive development occur together, that certain people in their environment are speaking perhaps one language, and certain other people might be speaking another language, and they learn quite quickly that these languages are distinct. And as they start producing language in the second year of life, they can produce words in either of these languages. There's even research showing that bilingual exposure and development of language in two languages can improve other areas of development, like executive functioning. So like your ability to have cognitive flexibility in your early thinking. And so there are actual benefits of multiple language exposure. This is not to say that you can't learn multiple more languages later in life. But infants and toddlers can, in fact, learn multiple languages in the first years of life.
Great. So Jolie Garfinkel had a follow-up question, and so she posed the situation where immigrant families might be going back to their original country, and how might that affect infants' language development or cognition? Will they adapt to the new environment?
Yes, the short answer is yes. Infants and toddlers, so migration happens at any point in the life cycle where children are moving, typically most often in these years with adults or older siblings from country to country. And that's certainly a case where there may be greater input. The balance of input in terms of different languages changes across different social settings, and migration is one great big factor. But so is are some fairly normative transitions for immigrant families, including transitions into childcare, right? So childcare, for example, can include exposure to two languages. It might include exposure to a new language. Children do then pick up both the receptive and start producing language in the new language that they're exposed to through things like transitions to childcare, certainly in transitions to a new country.
Great. And another quick follow-up question coming from Patty Longenecker is about, are the benefits the same if there's a lack of consistency?
I'm not quite sure what that means, but I'm going to interpret lack of consistency as a change in the balance of the two languages, right? So generally, advancing in one language is dependent on the quantity and the complexity of input from that language, right? So in fact, yes, if you do hear more of one language than another, you are going to be more likely to understand and then produce more language in that particular language relative to the other one. And if that balance shifts over time, that means the inputs to the child's developing language skills are also changing. So the development of the two languages does indeed proceed at a pace that is related to the input at particular points in development. So some researchers have noticed, for example, that at school entry, children who are exposed to two languages, they might show a greater development in one language relative to another, and that might be due to the balance of input. But that can also be addressed with greater input from the other language, for example.
Okay, great. So I'm going to combine a couple questions here. So we have one that was written in from Aishatu Sise in Mali. And his question was, what are some of the unexplored research questions relating to early child development and early brain development, and specifically in relation to building resilience for young children? So we have a couple people writing into the forum too. So Liz Chipman wrote in, can you talk about the effects of living in an environment of scarcity on child brain development? And Quen Simon wrote about addressing issues such as climate change and the need to change our relationship with nature, and just generally addressing a potential environment of scarcity. So I think this whole issue about the changing context in which children are living is a really important area for future research. But what else do you think might be important for researchers and practitioners to investigate in relation to learning more about the developing brain in early childhood?
Sure. I think a lot of the unanswered questions will be coming up later in the course, because I don't think we understand enough about how programs and policies can potentially be contextual sources of resilience, right? And I think Professor Shonkov mentioned this in some of his material, which is that resilience can come from naturally occurring sources such as families. So there's a great deal of research showing that that protective relationship with at least one caring adult can be a source of resilience in the face of adversity, even fairly extreme adversity. So there's a very well-known study of the consequences of early neglect and very poor caregiving in Romanian orphanages, where if the children were placed early enough with a caring foster family, those that kind of risk and harm to development could essentially be turned back so that the child was developing in the normal range by age 4. If, for example, they had been placed by age 1.5 or 2. So I think the timing of the source of resilience in development and how that might reverse what might otherwise be long-term harm to young children is something that we're only starting to understand. In situations of scarcity, I would say also in situations of conflict and violence, exposure to violence, we want to try to understand what the long-term benefits of quality early childhood development programming are for specific sources of risk. So we can think about the scarcity that's caused by climate change, such as disasters, floods, famine. We can also think about exposure to violence in communities through war, and conflict and involuntary migration, those kinds of questions. I think we don't have enough studies that have looked long-term enough at the kinds of programs that might build that resilience for those populations.
All right, great. So we have a question from Stephanie Estose, and she references the Lancet article and says that it provides a caution concerning compromises that could happen transitioning science from practice. And so I think this is a really great issue for our course, which is exactly about this connection between rigorous scientific research and then how those findings can be implemented into actual policies and programs. So do you want to talk a little bit about, some of the things that can happen during that transition and some of the risks and, how they can be avoided?
Sure. So I think the greatest challenge in the transition from science to, well, there's lots of challenges. Maybe the first one is the issue of contextualizing the science and the fact that though we might assume that certain patterns are universal across all the cultures and societies of the world, that's not going to be true within country or across countries. And so I think this really means that there is a great need for there to be researchers trained within countries, within a much larger range of countries than typically the rich country contexts where much of the, for example, English language research is produced in child development, and that we must have much greater emphasis on kind of culturally specific research. The second is that researchers are not always trained or in their kind of research training in the different ways to collaborate with different partners. And these might be local NGOs, they might be, for example, local childcare or preschool or health clinics. It may be with national policymakers, it may be with grassroots or activists coalitions. And that, I would say, is a very important set of skills for researchers to engage in. To bridge that divide between practice and science, and to understand what are the everyday questions that practitioners have, and that policymakers have, and that advocates have, where research and evidence could make a difference and might have some important points with relevance. Now, this course is designed to do that. The first part of the course is a little bit more on the basic science part, and then the latter part of the course is much more around evaluation and understanding programs and practices.
All right, great. So we have a question from Kiran Bandari, who's writing in from Nepal. And he asks, what are some of the components of early stimulation? And he says, basically in countries like Nepal, parents don't take part in early stimulation. And so what are some ways that programs could be implemented? And this relates to another question coming from Anu Parvateni, who's asking about evidence-based programs about encouraging the skills of families to take part in early childhood development and improve the environment for their children. And so I just want to say we'll be getting into a lot of these topics later on in the course. But this relates to, I think, another question we had from Aishatu Sise in Mali, asking, is the idea of serve and return interactions culturally adapted and accepted everywhere? So I think this broad topic about early stimulation, how to encourage parents to become involved, how to adapt them to these practices to different contexts and cultures. So how about we talk a little bit about this early period and the importance of relationships?
Sure. There is some, I think, there's some universality to the notion that infants, if they are not responded to, suffer from, in the extreme case, what we call neglect, which is that if an infant's cries, gestures, vocalizations which of course serve an evolutionary and biological function because infants can't grow on their own, right? So as a species, we have a particularly long period of kind of dependence on adults and caregivers. And that's why I think all over the world, the benefits of early breastfeeding, for example, and responsive nutrition practices are evident in research that's been conducted in many, many countries around the world. And that is an instance of very early serve and return interactions, which is the kind of responsiveness to the child's cries, which are, after all, partly driven by hunger, in the first, during infancy. And so the roots of that kind of responsiveness, that serve and return interaction, are something that is required in infant development to some extent. Then later, I think, if we think of the dimensions of language and how language is produced in interactions with the infant and in conversations that the infant hears, language-based interactions are another important dimension of stimulation. And then I think these questions are raising the important point that local cultural practices need to be taken into account to look at the specificity of the kind of stimulation that occurs with infants and toddlers, and how that can be encouraged. So I think there is some level of the basic need for serve and return interactions that are woven into the basic nutritional needs, but also the communication needs of infants and the need for social interaction. If infants are not interacting socially with other humans, and we have seen it in these extreme cases of neglect, their development is severely delayed. And that's because social interaction includes language interaction and includes exposure to adults with varying kinds of facial expressions and language and gestures in interaction with the infant. Then the particular form that that takes does vary according to culture and community.
All right, great. Building on this idea of interaction, we had a question posted to the forum from Fitsum Mulugeta, who is writing in from Ethiopia. And here it's, in Ethiopia, we have a child-to-child program where 5th and 6th graders will try to support pre-primary age children as a form of learning for those who would not get access to formal pre-primary programs. They're asking, is this a good idea? Have you heard of programs like this? Do you think it's a good idea for children's development?
In fact, yes, we do have the child-to-child program profiled as one of our programs in a later week. So I think it may be about 3 weeks from now. I think it's in the module on community-based programs. So you'll see, and we present some of the evidence of its effectiveness. So stay tuned.
Great. And so then we've had a couple questions about at what age does the cognitive development of the brain start to decline, and what potentially can be done to address the challenges of later age. And even we've had a few questions about, do older people have fewer neurons, or, what just happens and sort of towards the later part of life. But I'm also encouraging people to focus on the earlier stages and early childhood development. But I think this question about, focusing on these windows of opportunities, well, do we know much about the other part of the life cycle and what happens when potentially the brain starts to decline?
Yeah, so clearly I'm not an expert in the aging side of human development, but I think I want to make the important point that plasticity never entirely disappears in human development, which is that even in old age, there is plasticity, meaning that sensitivity of brain development to environmental influences. And so we know that interventions can make a difference, that stimulation of various kinds is still beneficial for people in the later years of life. And so it's just that the degree of sensitivity of brain development to the environment is largest when brain development is most rapid. And that's why early childhood has a particular kind of quality of high plasticity during these years. But plasticity never really disappears in human development.
Great, so that was addressed at Moses Wamaga also wrote in asking about plasticity and if there are references. So I just encourage people who are interested in this issue to look at some of our resources for the first couple weeks of the course, which are about, you know, the sort of sensitivity of the brain and its malleability and its receptiveness to its environment in very young children. So returning to some of the questions that were written in ahead of time, we have a question from Bishtran who wanted to know about the issue of selection and training for community health workers to be involved in early childhood development outside of health facilities. So I think this is a great question, not just for health, but for a lot of different issues related to early childhood development. Getting outside either formal care providers or other centers. How can we think about the role of community workers?
This is a great topic. Without a community health worker workforce, we can never get to scale for basic health services to both cure and prevent disease. So some of the great advances in the Millennium Development Goals period in terms of reductions in malaria, in HIV/AIDS incidents, or tuberculosis incidents, which are some of the major killers of children and adults, occurred because community health worker workforces were expanded, and these health workers were trained in some of the tasks and skills that had been traditionally the domain of only the higher skilled professionals in health clinics, right? So nurses and doctors. So actually overseeing treatment regimens for HIV/AIDS, for example, in rural communities, which are quite far from district health clinics, for example, those kinds of expansions of healthcare can't be done without a community health worker workforce. So this has been a critical workforce to go to scale in the health sector. And if you read the Lancet series from 2017, you'll see that there's a lot of emphasis in those articles on how to build on those successful examples and think of health worker workforces as the basis for also other kinds of interventions, such as early childhood development interventions, parenting interventions. So I think that is going to be something in a couple weeks. We're going to hear from Professor Yousafzai from Harvard when she covers the health and nutrition sectors. And there will be some great examples there of when community health workers have been trained also to implement parenting interventions in addition to their regular duties around kind of primary disease prevention and disease treatment. So that's a really important topic. We're going to return to it in a couple weeks when we go over the health and nutrition sectors, and then later on it will still be coming up, I think, in this course.
Great, and I think that's a perfect introduction to one of our questions from Fitsum in Ethiopia, asking about the potential tension between trying to get ECD services to as many children as possible, and particularly to poor children and harder to reach children, and the goal of only providing services that are very high quality and where you can ensure that those services are as good as they can possibly be. So the question is it good to focus on quality and getting it to fewer children, or should we do low quality programs but with better access?
I would love to answer that question by talking about quality and intensity and modality of services as three separate things, right? So I personally don't think that quality should ever be taken off the priority agenda for interventions. But I think what's been tested, what are being kind of evaluated right now in some examples around the world are whether the there can be, for example, shorter versions of typical interventions, and whether they can have comparable effects, right? So can a quality 10 or 12-week pre-primary education program in a situation where a country doesn't have the resources yet to provide a full year, can that have comparable effects? And that's a question that we don't know the answer to yet. And so those kinds of interventions are being tested. Can a parenting or home visiting intervention that was designed originally to be weekly visits for 1 or 2 years, could that be carried out with bi-weekly visits every 2 years? Can professional development for health workers or for teachers or for caregivers be delivered using smartphone technology? These are some of the questions around reach and expansion, where hopefully each of those would not be about, okay, let's sacrifice quality, but can we achieve perhaps lower intensity and less expensive versions of interventions that will still promote health and development and learning in kids? So those are, I think, some of the really critical questions right now in the evaluation field. So I'm glad you raised them, but I wanted to kind of make sure that we consider quality separately from intensity, and then the modality, how services are delivered. Thank you for that.
Okay, and yeah, just to remember, we're starting the course focusing on some of the basic science behind children's development, and we'll be getting into different policies and programs later on in the course. So we'll be looking at examples and considering some of these questions about implementation. So again, thank you so much for your interest, and look forward to later weeks in the course. So we have a question from Carmen Castillo saying, I was quite surprised to hear that touch has an effect on growth. Could you say a bit more about that?
Yeah, so I think that is an exciting area of research, and I think it has to do with the different domains of these kinds of interactions, right? That it's not just about language, it's not just about affect and facial expression, but that early touch between typically the mom and the infant right after birth can have these effects that I would say were surprising when they first came out in the literature maybe 20 or 30 years ago, and they've now been reproduced in various country contexts that can improve early development. And so the kangaroo care model of intervention is the most well-known. So if you go to the internet and look up kangaroo care, you can find the evaluations. We could send some around. And that idea of, for example, not separating mothers from their newborn infants immediately after birth, as can happen in some care or healthcare facilities, that has actually changed some practices in hospitals in the first weeks of life, and parallels can be implemented in places, where there are clearly not kind of formal hospital settings, but these are more kind of community-based childbirth. So it is somewhat surprising, maybe aspect of development. I think it has to do with aspects of biological development that show us that there's a whole set of interactions that are not just about language, but are also through all of the senses, including touch, that can build early development in the infant.
All right, great. So I think this is returning a little bit to the access question, but another really important dimension of the issue of access and quality, I think, is equity, right? So Mile Sigale writes in that quality, equity, and access are really important in delivering services. And so this relates to a previous question we had from Taruta Gabiche, asking if you can talk about the effect of economic conditions, and saying that there's a lot of disparity in India based upon economic status and how that relates to parenting practices or maybe the services that are available to children. So how can we think about this issue of equity in early childhood, and especially about maybe even targeting services, or how we can address the issue of disparities across economic or other forms of inequity?
Sure. The need to focus on all three aspects, access, equity, and quality, is something that I think is just an important set of principles for the implementation of ECD programs and policies. And unfortunately, we see all over the world that the most disadvantaged, whether by virtue of income and socioeconomic status or other dimensions that are related to disadvantage within particular countries, the more disadvantaged populations are the least likely to be able to access quality ECD services. And yet when evaluations have looked at this question, they find that the effects are as strong, if not stronger, for more disadvantaged populations. And so the populations, in a way that might benefit the most, are least likely to receive quality ECD services. And that's whether often we're talking about health or nutrition or educational kinds of services. So I think what that raises is the need to understand the distribution of disadvantage in a country geographically, to tie that kind of data and information to how programs are targeted within countries, and to make sure that those disparities are addressed. I think I would also add that dimensions of inequity are not just about income, but we'll see later in the course that children with disabilities, for example, are often excluded from early childhood development services, and or there's not sufficient training provided to the workforces in early childhood around issues of disability. So that's one that also, again, across countries, we see a pattern of inequity and lack of sufficient outreach to families with children with disabilities. And so the child protection sector in generally in countries could be strengthened around its focus on very young children. And there are often other dimensions of disadvantage within a country related to ethnicity or home language or culture. And so those patterns really differ according by country, and those are also, I think, show us the need for there to be comprehensive data systems that inform the implementation of early childhood development services. If we are not collecting accurate data on access and quality, both coverage and quality of early childhood development services, then we don't have a basis on which to really address the disparities most effectively.
All right, great. We have a question from Sahar Shaikh, writing in from Pakistan. And she says, in Pakistan, the government has initiated an ECCE program attached to primary schools. And she says, I'm concerned with programs that do not have an integrated approach. How effective can an intervention be, leaving out health and nutrition?
That's a great point. We will, I think, have some emphasis later when we even introduce the idea of sectors, that the overall frame within which we introduce sectors will be a multi-sectoral approach. And that means that in any particular sector of services, we should be considering the links to the other sectors. And that means, therefore, that I think education services, things like pre-primary education, should be paying attention to whether the families are also receiving sufficient support for health, for nutrition, and I would add for social protection and for child protection. So a school-based early childhood education program can still link to those sectors. Clearly, community health workers could be present in a school setting. The outreach in terms of family engagement could be intersectoral and incorporate assessment of the family's needs around nutrition, around health, around issues of poverty and economic needs, the livelihoods and educational needs of the parents and caregivers and adults in the family, and not just the child. So that's a very important theme that we're going to be getting back to when we talk about the sectors and different aspects of services in early childhood development. I wanted to just go back to that theme of equity because I've realized I didn't emphasize another theme which is quite important to addressing equity, and that is the issue of governance and participation in programs. And so here again, we're going to have some examples later of how local communities can and should be involved in the governance of ECD programs. And that doesn't always happen, but participation of local communities, again, with attention to equity and to the populations that are often likely to be excluded or not sufficiently enrolled or participating in programs. One way to address that is to involve those groups in the governance of these programs, both locally and even nationally, if we think of various stakeholders' input into the development of a national ECD policy, for example.
Great. And so again, we hope all of you stick with us to later issues in the course. Like Kiran brought up a concern about WASH programs, and I think this again relates to the intersectoral approach. And one of the programs that we will be reviewing comes from Uganda, and the Madrasa Early Childhood Program integrates health and sanitation, nutrition into education programming. And so I think, look forward to learning more about the policies and programs later on in the course. So we have another really interesting question coming from Luke Frank that I think introduces the idea of measurement. And that's something we haven't talked about yet. And so I think this is a really important issue we'd like to discuss today. And she writes, we know about stunting, but I was wondering if neurophysiology studies have been conducted looking into the effect of food insecurity or malnutrition on brain function in children. So I think this greater issue of what indicators do we have for children's development? Have we been relying exclusively on stunting or length and height and other very basic physical measurements? So how do we think about this issue of measuring, capturing, and developing indicators on ECD?
Sure. I think that's a great point, that beyond stunting, whether other dimensions of food insecurity are related to children's development. And I am aware of that there are studies linking food insecurity and economic insecurity to children's cognitive and socio-emotional development. And I think those can occur through different pathways. So, for example, food insecure households are often also economically insecure. That can affect children both through the kind of nutritional pathways, but also through the stress that those households experience. And we know that those can affect children's development through these different mechanisms, both of kind of malnutrition and what that does to both biological development and cognitive development, but also what household stress causes in terms of effects on children's socio-emotional development. So I think that's a very important point. We have to think about the issues of poverty as being multidimensional in how they affect children. They can affect children through the poor conditions and resources when adults have less access to secure livelihoods with good wages and work conditions. Poverty can affect children through food insecurity and the malnutrition that creates. And poverty can affect children through the stresses, the chronic stress that often comes with poverty, especially as in much of the world when this is cyclical. And Different times during the year can represent times of greater resources and greater scarcity. And in some countries that occurs on a monthly basis. Here in the United States, we often think of these among low-income families as having a monthly basis because the social protection benefits in the United States are often distributed on a monthly basis, but are sometimes not enough to really cover a family's basic needs. So there are these multiple pathways, one of which is food insecurity, but the other aspects of poverty that can affect children's cognitive development, their socio-emotional development, and also their health and growth.
All right, great. So we have Daniel Ars writing in from Japan, and he asks, are there negative effects for a child when a mother leaves an infant or maybe even a toddler in preschool or daycare? Or conversely, are there positive effects? So I think this also introduces a really important role about mothers and either employment issues and working, and then the equivalent concern about childcare and what kind of environments and opportunities are available to children in those types of settings.
Mm-hmm. The overall lesson that we know from the childcare and center-based programming literature is that when programs are of good quality, there are consistently benefits for children. And those are maybe the strongest in the kind of cognitive areas like language development. But they can also be in the areas of social development and motor development when programs are of good quality, and then they actually do support children's skills specifically in these domains by providing a warm and nurturing environment, by providing responsive interactions, language-rich interactions, and opportunities for play, incorporating local materials of various kinds. So when these programs are of good quality, we see consistently benefits. And that's whether we look in the low and middle income literature or the rich country literature. So when programs are of poor quality, we occasionally see that there are either no effects or even negative effects when care quality is low in these out-of-home environments. So the lesson I take away from that literature is that really quality matters, and that means that the degree of training of the caregivers and teachers matters a great deal, and their ability to support children's early learning, their socio-emotional development, their motor and physical development, all of those things matter a great deal. And to bring back the earlier conversation on other services, if the centers don't have access to clean or filtered water and don't have sufficient sanitation facilities, then children's health, of course, can suffer from transitions into these environments.
All right, great. We have a question from Emmanuel in Sanzumukiza. He's asking, is there a stage in children's development where brain development is at the highest level? So I think he's asking about what we've termed windows of opportunity, or the plasticity of the brain, or this period when the brain is most sensitive to environmental or external influence. And he asks, what age is that? And does that also apply to children older than 8 years or beyond? We've had a couple people ask about the specific ages we're including in our definition of early childhood. And I just want to remind people that we're taking a really inclusive definition here. So from the prenatal period and the support of families even before the child is born, all the way through 8 years of age. So this course is taking an inclusive approach to the definition of early childhood. But this question about, are there particular times when the brain is most sensitive or when brain development is at its highest level of potential?
So it is true that brain development is happening simply at a more rapid pace, meaning that the connections among neurons are being, the synapses and connections are are being built at a much higher rate in the early years than later in life. So broadly speaking, more rapid in the first 3 years of life than later in life, more rapid in the first 5 and 6 years of life than later in development. But I think this raises, I think, the question of plasticity again, which is that there are these windows of opportunity that are sometimes called sensitive periods that we see may differ depending on the particular kind of skill and children's capacity. So for example, basic sensory development and visual development, if there is not actual stimulus, meaning exposure to at the very most basic level, light and dark, but all the kind of stimulus of the environment, that period of sensitivity of the brain to developing a basic visual perception is actually very early. And so if there isn't due to either some kind of disability as far as vision or actual lack of input, that window is actually earlier than that for language, which is broader in the early childhood years. But again, if there is almost no input on language, that can also be a result in some deficits, certainly by the early childhood or preschool kind of years, if the degree of language input is severely restricted by situations of, for example, neglect of children. So I think even though overall brain development is more rapid and more sensitive to the environment, overall, some of the sensitivity to different aspects of children's development varies across the first 8 years of life.
Right, I think this is a wonderful question, especially given how diverse our course participants are and that we're taking a real global perspective with our online course here. But Alberto Ligi writes in to ask, how do we think about or how do we feel about what's driving the universality of human emotion? And how do we reconcile this with the way in which different cultures define child temperament in different ways, and how there is so much cultural variation in emotion and children's development and social development. So how do we think about that balance between the universality of human emotion and development, and then sort of culturally specific practices or beliefs or behaviors?
That's a great point. Yeah. So we have a sense that some of the emotions, as far as the kind of the famous studies around how these are reflected in different forms of facial expression across cultures, that some of those, there are some universal patterns around some of these emotions. But I think, Alberto, what you're mentioning is that then the response of a given community or a culture to those expressions immediately starts bringing in culture. And because culture is the meaning-making process that is transmitted across generations, that produces some stability in values and beliefs and associated behaviors in communities, and that some of those behaviors include caregiving and the perceptions of children at different points in their development. What you're raising is that the issue of temperament, how people categorize other people, right? Very early in life. How do adults categorize infants? And how are characteristics like reactivity to stimulus, or the degree to which a child shows different kinds of affects, which are, after all, facial expressions. All of these are parts of the response to some of the universals. And so I think that's one of the more fascinating questions in early childhood development, is the interaction of culture and context with some of the biological universals, which are, of course, things like growth, things like some universalities in facial expressions, some universalities, of course, in kind of the basic needs of children for social interaction, for nutrition, for adequate resources in the environment. And so I think this gets back to some of the ways in which Kathy Thomas-Lamanda introduced her part of the course with the work of Heidi Keller, and the different aspects of caregiving and child development that are valued in different cultures around the world. And so I think that intersection between temperament and emotion is also a very good example.
All right, so to briefly return to a point we mentioned earlier in our discussion of equity, we've had Quinn Simon write in to talk about children who might have a different developmental path. And so I think the issue of children who are at a disadvantage or who have developmental delays or other types of challenges. Does the course address children with disabilities? How do we think about some of these issues? I think this is a really important question and really important point. She writes about a child having epilepsy, and so the developmental delay, she's just starting to say single words at the age of 3. So I think this issue of disability is so important. And just how do we think about it? How do we address it in the course? How can we encourage other course participants to be aware of these issues and think about integrating them into some of their own work?
Sure, that's a very important point. And when we will be introducing it in the module on child protection by profiling a few countries' approaches to integrating issues of developmental delays and disabilities into their ECD programming and policies. So instances of policies that have been responsive in their design to the actual programming implications of that. So that will be starting 2 weeks from now. We're going to start going through the different sectors of early childhood development programs and policies, starting with the multisectoral kind of approach, and with health, nutrition, education, social protection, and child protection addressed. And in the social protection module, we'll be talking about some of the approaches. I would have to say, I think this is an area where globally the ECD field is weak, and that we don't have sufficient attention and integration of child protection, particularly around the large range of delays and conditions, right? From moderate delays to the more severe disabilities. The responses to kind of provide a preview, I think the principle of family engagement around these issues and the construction of care is extremely important. I think the training of workforces in the settings of early childhood development, the inclusion of children with disabilities into settings where normally, quote unquote, normally developing children are also being served. All of those are important principles from the kind of model child protection policies that we see around the world. But in far too many countries, we don't see this sector developed or integrated in a specific way into the basic early childhood development sectors. And it's a great example of how the field needs to be more multisectoral in its approach and provide access to that kind of specialized training and professional development.
Okay, wonderful. So we've had a lot of people writing in, and we're approaching the end of our webinar here, but we encourage you, please take some of these discussions to the online forum that we have as part of the course platform. And I think we sent out a post this week encouraging people, not just to pose questions, but to please follow up with other people's posts and engage with others to discuss and learn more. We've had more than 40% of our course participants have 10 or more years of experience working in early childhood. And so that is an incredible opportunity to learn from other people about the role that different organizations and individuals have been playing throughout the world. And so I think to end, we have a really great question about thinking forward and asking, when does policy come into play? So we have a lot of people in this course learning more about some of the basic science and different programs and opportunities, but at what point does the policy start? So this question is coming from Ruzika in Cyprus. And so what are some of the practical points about policy? How do we translate knowledge into actual programs on the ground? And what role might the scientific community have in this, or the government, or even grassroots movements?
Sure, great questions. We are going to get to them later in the course. Just to give you a sense of the rationale behind why did we put programs before policies, we didn't. The week on policy development and implementation occurs after we've already introduced the principal kind of sectors of early childhood development programs. And that's because we wanted to give everyone a sense of what some of the basics of providing a quality health program nationally, nutrition program, education, social protection programs with attention to early childhood and child protection, before we then get to the idea of how are policies developed. We're in a tremendous point of development in our field when we have upwards of 90 countries nationwide that have national early childhood development policies. And so we have started to learn about the practices, the inclusive practices in their development, and then how they can be implemented with attention to quality that is at essentially national scale. So those issues come after we introduce the sectors, and that's because we wanted to give a sense of the programs. And we felt that introducing the development of national policy without first understanding the sectors maybe wasn't the right order for a introductory course like this. So, but we do have a week on these issues of policy that include issues of the development of policy, the implementation, the challenges of quality improvement, and finance and governance in ECD policies. So again, that's a great question. It'll be after the sectors and in a few weeks' time. Thank you.
All right, so we're unfortunately at the end here, so thank you so much, Hiro, for joining us. We really appreciated everyone on the chat, everyone writing in. We're so excited. We've had such a positive and enthusiastic response to the course, and we're just getting started, so please continue to engage both with us on the course team and then also with each other. Like I said before, we have an incredible, diverse, global group of course participants, so there's a lot to learn from each other. We will be having our next webinar this coming Tuesday with Dr. Kathy Temis-Lamanda, focusing on this second week of the course, which focuses on ages 0 to 3. So again, thank you so much here for joining us. Thank you everyone online. It was great to meet some of you, and we look forward to continuing to interact with you as the course continues.
Thanks so much, Sarah. You know, we have to thank our fabulous teaching assistant, Sarah. These questions were really remarkable and very thought-provoking. And I think they covered, you know, the whole field. So we're very excited by the expertise and the interest and the quality of the questions in the course.
All right, great. We'll see you again soon.
Thank you.